What if your brain told you that something terrible would happen, unless you performed a ritual? For people with OCD, this fear feels very real, and it's wired into the brain itself. In this week's edition of Clinical Neuroscience Thursday, let's take the example of Samantha Pena, a patient with the symmetry and ordering subtype of OCD, whose compulsions I described in my previous video.
If this need for balance didn't come forth, I believed bad things would follow. I am not exactly sure what these bad things were, but I knew I was never willing to wait to find out.
The sense of fear, anxiety, and worry is the main driver of OCD compulsions. But stay tuned for next week's video on the physical sensations that can also be triggers. OCD patients tend to have increased activation in the amygdala, which is the brain region in charge of regulating our fear and threat response. So hyperactivity in this area leads to increased anxiety about perceived dangers. The orbitofrontal cortex and subgenual anterior cingulate cortex are areas involved in emotional regulation, decision-making, and impulse control. These areas are also dysregulated in OCD, which is thought to underlie the compulsivity of these anxiety-driven rituals. Want to learn more about neuroscience? Follow Brainstorm for daily info.